Good afternoon and welcome to today's Ashgrove TV. We're going to be looking at breastfeeding, tongue tie and osteopathy for babies. We actually have 4 specialist paediatric osteopaths in the clinic, but we couldn't get them all on the show at once. We don't have enough chairs. So today we have Kate Schutz Walton joining us. Kate is an osteopath, a tongue tie assessor, a breastfeeding consultant and is registered with the Federation of Antenatal Educators. Kate, thanks for coming in.
Thank you.
So, I guess over the years of working in the clinic where there's lots of osteopaths, I've got familiar with how it can help in more ways than probably most people appreciate. Mm-hmm. And also I've personally recommend friends, family who've had trouble with newborns to the osteopaths. But for anybody probably who isn't aware of how much it can help, what's some of the, before we get into some of the specifics, what's some of the key things that you can help babies with?
Well, there are a multitude of things that parents come to me with. So babies who are showing signs of reflux, colic, unsettled, aren't sleeping, breast pain, mastitis.
There's a lot.
Oh yeah.
And we've only got half an hour. There's a lot of different things that can help with. So a couple of things that we said we'd talk about today was breastfeeding and tongue tie. So I guess if somebody's experiencing those problems, they know what it is. But if someone's not sure or they're a new mum, firstly, what is tongue tie?
So that is a very good question. There's a lot of debate on the subject and there's probably not enough research. So a tongue tie and a true tongue tie is when the frenulum, so the stringy bit underneath your tongue, is impeding on the function of the tongue. And so that's basically it. It's if the tongue isn't functioning, then there's a multitude of problems that can happen and then prevent feeding.
So how might that show up?
So mum might experience sore nipples, cracked nipples, pain when feeding, because breastfeeding shouldn't be painful. Breasts not emptying, and baby unsettled at the breast, baby struggling, not latching properly, not enough breast tissue in the mouth. It just doesn't look or feel right, and the mum will know that.
So tongue tie sounds like it could be quite painful, but it's, like you say, it's more to do with the function of the tongue.
Yes, yeah.
Can it be painful for the baby?
No.
No.
It's a piece of anatomy.
Yep.
It's there.
Okay. So how might you go about helping somebody who's experiencing tongue tie?
Okay, so initially I would do an assessment to diagnose tongue tie or not, and then there is the categories of tongue tie, because it's not just a tongue tie. I use a systematic way of assessing the tongue through its function and appearance, and then from that there are variations to the tongue tie. So posterior tongue tie is very different to anterior tongue tie, and then the way you deal with it is very different. Anterior, if it's a true tongue tie, which is about 4% of diagnosis, would need a release, but that's usually when your frenulum is attaching the tongue to the tip of the ridge of the gum line, so the tongue cannot move. Right, so
a physical.
Yeah. But all other tongue ties I treat and am able to help with and resolve. Okay.
And when you say you treat and resolve it, what might that look like? Because again, I think a lot of people still think as osteopathy as the neck and the back and the kind of key thing. So when it comes to how you can help a baby.
Yeah, a little tiny being, yes.
And I've witnessed it and seen it, so I know it's nothing like that, but how can you kind of...
So we would help with cranial osteopathy predominantly. Yep. Sometimes a little bit of structural osteopathy. So it would look like very light movements on the baby. And the cranial osteopathy kind of looks like we're not really doing a lot.
It does. Yeah, it does. But the results
just holding the baby.
Yeah.
And then we would usually give exercises to get parts of the anatomy moving
Okay.
that are restricted.
So it's things that they can do themselves to
Yep.
kind of help
Give
as well.
the parents tools to help themselves. And then obviously it's very much linked into attachment and positioning, and then what is happening in the anatomy of the baby as well.
So it is very kind of gentle, and like you say, it almost can look like there's not a lot happening.
Yes. Yeah.
So there's nothing kind of untoward going on or anything that would
No, we don't.
cause people concern that their baby's going to have some kind of strenuous physical.
Yes, absolutely not.
No, and I've seen
It's-
it and witnessed it, and it literally just looks so gentle and calm.
It is.
And often the baby will sleep.
Yes.
They don't all, because I can sometimes hear them crying when I'm working. But
That's usually when they want feeding or something like
nothing
that.
to do with what you were doing.
No.
So is the tongue tie and the breastfeeding that you work with and help, are they kind of two the same thing, or is it two separate things that people come to you with?
Both.
Yeah.
So, but usually it intertwines all three:
Okay.
osteopathy, breastfeeding, attachment, and also the tongue tie.
And there's a lot of pressure put on new mums or mums in general with breastfeeding. So what are some of the
Absolutely.
challenges that come up that you can help people with?
So that's exactly why I became a breastfeeding coach and tongue tie assessor as well. So I had that base knowledge under my belt as an osteopath to give parents and the mother confidence and just to know that everything's okay. They're okay. They're not going to end up injuring their baby because they haven't followed the rules, or because not all the rules fit everybody.
No, every baby's different, every person is different.
And their
every mum is different.
lifestyles.
Yeah, absolutely.
That's it. So that's what we tailor to.
Okay.
You've got to fit around. Otherwise, it just won't work. It's natural.
Yep.
Childbirth is natural. Pregnancy is natural. A newborn baby is very natural, and they have certain ways and cues that they'll show. And if you're missing those because you're following rules, then you'll find other problems occur.
Okay. Yeah, and I think as a hypnotherapist, that's when I've seen people who have struggled with stress and anxiety because they feel like they're not doing it right, or there's some guilt attached to it. Often years after the event, you know, that mum guilt, being told or led to believe they were doing it wrong, and that can only make things worse, can't it? If mum is stressed and anxious.
Yeah, if mum's hot, so the baby and mum regulate each other's hormones to allow the baby to be supplied with exactly what it needs. So if those hormones are disturbed in any way, fear, so that's already disturbing the natural pathway that the mum and baby should have.
Which just makes things more difficult.
Yes.
Yes. And I think a new mum or a mum in general with a newborn, it can feel quite isolated and lonely at times, and that can be a struggle as well. And I think this is a topic that has created a lot of interest because we've got some questions that have come in before and we've got some coming through now. So I'll just check. Sarah said, I was told it's quite normal for breastfeeding to hurt at the start. Is that right?
No.
End of. That's the answer.
Yes.
Just a straight no.
No. So when you have your first baby, you've never opened up the ducts in the breasts, so to the extent that they will be when breastfeeding. So they will expand, so you'll have some ligamentous tension, possibly, but that's within the breast. If you've got pain within the areola or the nipple, you're looking at other issues.
Okay.
Yeah.
So if there's anything not quite functioning as you feel it should, then that'd be a time to have a chat and...
Absolutely. Well, yeah, and you get distracted though having your baby, especially your first as well, because you haven't really got a clue of what's going on. You can learn as much as you like beforehand before having your baby, but then when you're in the position of having the baby, you're guided, I guess would be a word to use, to do things in a particular way, or that sometimes there are opinions of professionals that perhaps
conflict.
Yes, And then...
You mean there's not one textbook that we should all be following?
Absolutely not, no.
But that creates kind of that uncertainty, doesn't it? And then that's when people question and doubt.
Exactly, and that's where their fear comes in, and the frustration comes in, and the upset, and the mum guilt. Which
is not fun.
Yeah.
So, Tegan, does cranial osteopathy hurt the baby? I know we've touched on that already, but as the questions come through, more than a one-word answer of no, how would you answer that one?
So cranial osteopathy doesn't hurt, but it's very, very gentle, using very, very gentle techniques. But in some treatments, I have noticed they do feel the release of tissues, and you might get a better attachment at that time, because we treat while the baby's feeding, and we work around the mum and baby as well, so that they're comfortable throughout the whole treatment. And it's easy to do. And the mum might notice that the baby's attaching differently during the feed, or they might become sleepy during the feed, or they might become elongated during the feed, and they might come off for a moment, and it's only that connection between the mum and baby where the mum will notice, oh, that's not normal, that's not what they normally do. But that's about it.
So, as we said earlier, it's very calm, it's very chilled.
Yes.
And often they'll be feeding or sleeping.
Yes, yeah. Or sometimes it will kind of make them sleepy as well. Yeah. Yeah.
So it sounds like great. So Sam says, can tongue tie cause colic?
Oh, so there's a topic that hasn't been fully researched, I suppose. There are links to the symptoms.
But no kind of clear...
Solid answer, nope.
Okay, just possibly, but...
Yeah.
Okay.
Yeah.
It's the best we're going to be able to answer that one, isn't it? Okay, Sarah, in the tongue tie... Sorry. If the tongue tie is obvious, will I see it myself, or do I need an assessment? Should I get it cut?
If it's a true tongue tie, yes, it'll be very obvious.
Okay.
Other tongue ties, such as posterior or query posterior, you wouldn't necessarily know. No, you'd maybe just have discomfort on the breast or the feeding or the attachment. The baby isn't opening the jaw wide enough or extending the neck to be able to go onto the breast.
Okay. But again, to reduce mum guilt, it's not necessarily the baby's going to be kind of struggling with it, it's just it's going to impede on the baby's ability to feed. Is that correct? Okay. One anonymous one here. My friend has been told by her family not to breastfeed because it's a bit yucky. Could you tell me your thoughts on this one, please? I'm sure you've got a thought on this one, I can tell already, so what would you say?
I always tell my patients that there are always conflicting views, and I think from the 1950s, where they brought in bottles so the women could work, it's natural. They fill with milk when the baby is born, and there is the full natural process of the baby bringing in the milk and then having everything that they need from the supply. Everyone does have an opinion, and I think that is just it. So the mum has to do exactly what she wants to do so that she is happy and the baby's happy.
Priority.
Yeah, absolutely.
And if for whatever reason somebody eventually is unable to breastfeed, they shouldn't feel the guilt for that either, should they?
No, no. There are many reasons why people can't breastfeed right from the beginning, or choose not to. And then obviously if there's a lack of supply at some stage for one of many reasons, then that again is just, it's something that you can talk through, and that's something you can also talk through with us, as to try and unwind it so that you have an understanding how that has happened. Because I think, like we've already touched upon, if you don't have an understanding of something, then it creates fear and anger and frustration and guilt.
Yeah, which it's not a nice mixture, is it?
No.
I see you've brought some props in, so it'd be rude not for me to ask you what they're about and what they're for, or what you can demonstrate with those. So let's introduce.
Well, I have a boob, and I use it in my when I'm treating. And then I also have Annabelle here, who I use to show positioning and how to bring the baby to the breast as well, because there's a multitude of areas that are very sensitive to touch on a baby when they're first born and in the first few weeks, and then up to 3 months as well. So once a baby is born, they use them to find the breast. You don't have to help the baby at all. You just pop them on your stomach or on your chest and they will find the breast. Okay. And it's that first initial contact with the breast that sets a really good breastfeeding journey for the mum and baby. So I use this to demonstrate where the baby should be, how they should be approaching the breast, and also how you can hold the baby to stimulate those sensory areas for them to attach on really nicely.
And is there anything you could demonstrate to anybody today?
Right now, okay, so I don't know if you can get a good angle on. So you would hold, okay, we'll start with just the baby. So the most common one is cross cradle position. So you would hold the baby with your arm along the spine and hand in between the shoulder blades. So that's your first sensory area. As soon as you're in between the shoulder blades, the baby starts to extend. You support with the one finger, the head, and then the next sensory is the hormones are already flowing and the baby knows it's going to be fed and wanted to be fed.
Baby's ready.
Before, yep, absolutely. So then you're going to attach the baby onto the breast, but you'll find, depending on what stage they're at and depending whether they're cluster feeding, there are lots of
variables.
Yep, absolutely. So the baby will fuss at the breast, and it's completely normal for them to put a lot of saliva in and around the nipple and the areola. That's a lot of communication, hormonal communication with the mum's body and her hormones to produce exactly what they need in the breast milk. So they may fuss around on it, put some saliva on it, come on, come off, come on, come off, and then other times they may just go straight on. But then once they've done their job, if you like, they will touch the chin onto the areola first. And what you want is, I don't know.
You care, they're good enough, they'll get the angles.
So is nipple up the nose when you're going to attach. So the nipple, if you look, there's a line directly through the cranium to the top. You're going to bring the chin to the areola, another sensory area. As soon as that chin touches, you've already got this extension from in between the shoulder blades. As soon as that chin touches the areola, the head extends. So you've got both. Sometimes though, a baby won't do that because they've got restrictions within the body or the neck, diaphragm, different areas. They physically can't. And you'll notice that if you've got everything else right, that's probably a time to come and see one of us. Second would be cheeks here. So that's for them to try and find the nipple itself so that they hit the bullseye, if you like. So, and then they'll extend and then they'll open. As soon as they're here, they can open really wide. And then that's when they go on. And you've got a nice amount of breast tissue in the mouth. And then they start feeding from there. And you just leave them to it. They know exactly what they're doing. But sometimes you have complications during birth or other processes that create restrictions.
Yeah. So that's quite a lot of information and tips there, but obviously anyone can watch the replay back and go back over that.
Yeah.
But if anyone's
the most important is your positioning. So cross cradle is this one, nicely tucked in. You want them around far enough so that they can have the nipple up the nose, if you like, and nice and snug, and then holding on here so that they're quite far over to what a lot of people would expect. They'd expect to bring the baby here and just pop them on this way. But there's a lot more to it Then you want to see the mum and the baby together to see what's best for them, because there are other holds as well. It's not just you've got cross cradle, you've got rugby, you've got natural birthing, natural position, all kinds.
Yeah. So I think what that highlights is there's options, isn't there? So that if you're struggling, don't kind of
absolutely. Everyone's anatomy is different as well. So not one breast is the same.
But if you need to, then reach out.
Yes.
For some extra guidance.
Absolutely.
There's another question just come in. Sam, I'm worried my baby might want to feed or poo during if I bring her to treatment. Will it matter?
I expect them to have a bowel movement.
Okay.
It's what happens. So if you've ever had I liken it to having a puppy. As soon as you feed them, you've got to kick them outside because you know they're going to have a bowel movement. Now, a baby's even quicker than that. Right. So when that tongue, that's the first sign a baby wants to feed, kind of comes out. They're just a little bit, you want to put them on. Okay. That's the first stage. There are other stages up until the point they're then crying. You don't want them crying, by because then it's harder to get them on. Sorry, what was your question?
Will it matter if they need to feed or poo during treatment if they were to bring the baby into you?
No. No, it won't.
It's all good.
Yep. I say do what you need to do as you need to do it. I'll work around you. And because it's a natural situation, you can't...
So there's a high chance they will anyway.
Yes, yeah.
So don't fight it.
Yeah.
Don't worry about it. Okay. Tegan, do you know why my baby is so windy after feeding? Is there any reasons why there might be extra wind? I know, again, every baby's different, every situation is different, but are there any kind of generic reasons or tips that you could share with Tegan?
Windy after feeding. Is this burping? Is it the other end?
Specify.
Is it?
Just
okay. Windy after feeding. So if it's breast, yes. And it probably comes down to the diaphragm. Okay. More than anything. If it's windy, bottom burps, if you like, again, there will be restrictions there as well. And there are lots of factors to consider as well as to be able to answer that question. So it's better to come in for an assessment. Okay. But there are things, if they're concerned that the baby may be too windy, there are reasons and things you can look at to help. Absolutely, yeah. So Sam, can tongue tie affect bottle feeding too? Usually, most of the time not, but yes it can. Okay, Tegan's followed up with, sorry, she's burping lots. Okay. So yeah, that commonly you would end up at the diaphragm, working on the diaphragm, and then the anatomy attached from there up into the throat and into the mouth. Okay. So restrictions, tight muscles, things like that. So regardless of whether it's breast or bottle, tongue tie can kind of be a problem? Yes, yeah. Okay. Elaine, how do I increase my milk supply? Are there things I can do, or can you help? Yes and yes. So to increase the milk supply, obviously again, it'd be good to have a conversation and assess to give you the right advice. So, but generically you can increase your supply by stimulating the breast. So whether that's using a breast pump, whether that's massaging the breast, whether it's arousing the breast, you can, and then it will depend on the amount of times you do it and the amount of times the baby's feeding, because the baby will stimulate the breast as well, and consistency. Okay. So a few things to and there's consider. More. But but without knowing all the detail, there's a couple of things that you've highlighted. Yes. Yeah. A couple more questions. They're coming in today. Can tongue tie cause speech problems later on? Yes, they can. It can. Again, though, it depends what kind of tongue tie. Because someone will see a professional and they'll say they've got a tongue tie, and sometimes they won't come away with the assessment card to know exactly what kind of tongue tie it is, how it's been assessed. Like I said, there's there's a lot of debate on this topic. So there's not one hard rule for a diagnosed tongue tie. So I diagnose tongue tie often, but it's something that's treatable.
But knowing what type of tongue tie it is going to be more helpful.
Yes.
Okay, so make sure you get a bit more detail from a diagnosis or an assessment.
Yes, absolutely. Okay. Yeah, it's very helpful.
So Peter P, is tongue tie overdiagnosed at the moment? I get the feeling all the babies around ours have tongue tie these days.
Yes, I have that feeling too.
Okay.
So, actually, I saw an increase probably, where am I now? Maybe 12 years ago? I might be out by a couple of years there, but roughly around then, yes, there was a huge increase on diagnoses of tongue tie. And I think it worries parents a lot because they want to be able to help their baby and know where the problem lies. Is it the tongue tie? Is it because you'll have parents come in, or the mum, and say that I've been told it's tongue tie, but I feel there's something else going on. And they're usually right.
Okay.
I always tell the mums to follow their gut instinct, because at that point when you've just had a baby, the mum's the only one that knows the baby truly.
So trust it.
Yes, absolutely. Yeah.
We've got a question from Sam. What happens in your mum and baby checks?
Okay, so they are a longer appointment because I will be assessing the mother. We go through the whole pregnancy, birthing process, how she's doing post birth, and I'll ask multiple of questions to get an overall view of how the mum is doing and where treatment might be most beneficial for her. It's helpful if someone can come in with mum to have baby.
Okay.
Whilst, because there will be some treatment involved as well. And it's managing the hormone levels, I suppose, of a new mum, because when a baby's fussing, when a baby makes a noise, when anything, you're on high alert. Yeah. And so to be able to do a treatment, you need the mom to relax. And so that's why it's helpful to bring someone in. So so it's kind of like a normal treatment, but for a mom. And then the baby's there, so we go straight into the baby and into the feeder. We can accommodate the whole thing into one treatment rather than making multiple appointments.
So it's really taking the time to spend with them and really go through everything with them,
yes,
as best you can,
and make sure.
Listen.
Yeah, and also make sure the mom's comfortable, because if the mom's comfortable, then the baby's going to be comfortable, and vice versa.
How long do those checks typically take?
Hour and a half.
Okay.
Yeah. So again,
time.
Yeah, there'll be feeding in between. There'll be other things going on, because the baby's not necessarily going to wait an hour and a half to be next to mom again.
They don't know the clock yet, do they?
No.
I'm mindful that we're going to run out of time very rapidly, but I see you brought another friend. Have you got?
No, it was just for
different. I don't want to leave them out.
No, I haven't named this one either.
Okay.
So, but this one just it's a brand.
Just another demonstration.
Yes, yeah. This is for a bigger baby. Obviously, newborn babies are a lot smaller than this. I can show massages on this baby and things like that. Yeah.
Well, before we do wrap up, is there anything you wanted to kind of share, and any tips or advice or any guidance you wanted to make sure you share today?
So I think don't suffer alone. If you have an inkling that you need to address something, or something's not quite right, come and see us. Because no question is too silly or too gross or too little or too of any variation.
So just get in touch, have a conversation.
Absolutely. And we do free consultations as well. Yeah. So if you wanted to briefly have a conversation to see whether the appointment is applicable, then do that.
You have a wealth of experience, and you've probably seen and heard most things. So
we'd be able to
it's
say,
worth a chat, isn't it?
Coming in. Yeah.
Great stuff. Well, Kate, thanks for joining us today, and that's pretty much all we have time for. So thanks for all the questions. It really helps, and I'm glad so many people have found this topic really useful. And I wish you all a great afternoon. Take care.